Hello and good afternoon, good morning, good day to everyone who has chosen to join us for this very special London Global Cancer Week Commonwealth event. We are so happy that you chose to join us this afternoon for what promises to be a very exciting evening. My name is Lane Robinson, and I'm the head of social policy. And permit me just before we begin to give a few administrative instructions so that our session can proceed as easily, as simply, and as smoothly as possible. Well, first of all, let me request everyone that has joined us to please always remain in mute. So you'll keep your microphones off and your cameras as well. This will help us to maintain a good, even communication and can hear each other as we discuss together this important issue of cancer prevention across the Commonwealth. For our guests, we will invite them on the platform, so you'll be able to engage with them through the chat function. If you have questions or comments, we invite all those who are listening, all those who are participating, to use the chat function to put your questions and your comments, and at the appropriate time, we will take them on. If you are having any connection challenges or difficulties, we have a very good team in the background who are available to help you. If you can't hear or not seeing very well or having connection problems, they will be there to help. If you want to still invite others to join, we will put the connection in the link, and you can send this broadcast link out so that others can join. We have a fantastic afternoon planned, and I would want to now at this point introduce the person who will share and will guide and steer us through this fantastic afternoon's program, Dr. Anne Gallagher. She is the Director General of the Commonwealth Foundation. She's a lawyer, a practitioner, teacher, and scholar, and has worked at international level in the field of human rights and administration for criminal justice for almost 30 years. We're so pleased that she has agreed to chair this session, and we will no doubt call upon her vast experience to guide us through what promises to be an interesting conversation, one that we hope will give us some insights and some practical recommendations for the future. Before we ask Anne to take the floor and to steer us through this afternoon, we will now share a video link, a montage that sets in context the reason why this issue of cancer, cervical cancer, is so important for the Commonwealth at this time. Please watch, after which the next voice you hear will be that of our moderator and chair, Anne Gallagher.
Thank you. Thank you. I hope, can I just have a technical check that the audio is fine?
You're doing well now, Anne. Thank you very much.
Okay. Well, thank you so much, colleagues. Thanks to Lane for that introduction, and good afternoon, morning, evening, everyone. Secretary General, colleagues, and friends. The warmest of welcomes to this second session of Day 4 of London Cancer Week, where we're getting to the people's perspective on dealing with cancer throughout our Commonwealth. I'm very happy to be here in my capacity as Director General of the Commonwealth Foundation, one of the 3 intergovernmental pillars of the Commonwealth. Our mandate is unique. We exist to advance the interests, to amplify the voices of Commonwealth civil society on issues that matter to the lives and well-being of Commonwealth citizens. And there can be absolutely no doubt that the subject matter of this meeting fits squarely under that heading. As the Secretary General reminded everyone earlier today, cancer affects every family, community, and social class right across the Commonwealth. Cancer also exacts a terrible toll on national health systems. The COVID-19 pandemic has laid bare the fragile state, the fragility of health services in all countries, with our low and middle income member states facing special challenges. So we're here today to really ask the big questions. First of all, how do we work together to deliver effective, affordable cancer treatments to Commonwealth citizens? Second, how do we work together to improve our approach to prevention? And third, digging even deeper, how do we unite to address the social and economic inequalities that inflate cancer rates and deny adequate care to so many? This final point is critical, not least because this is where the Commonwealth is playing a key role and must continue to do so. On the matter of cervical cancer, for example, the Commonwealth's been able to take a lead in pushing for the kind of policy reforms that will make a real difference in both prevention and treatment. But the Commonwealth has another equally important role to play, and I heard that loudly and clearly as we listened to that video. As a champion of human rights and equality, the Commonwealth is uniquely able to highlight this aspect of the fight against cervical cancer. We know that women and girls in low and middle income countries are more likely to suffer from cervical cancer, and they're less likely to have their cancer diagnosed. We know that they face poorer treatment outcomes. The fight against cervical cancer is also a fight for the rights of women and girls. Now, we have a wonderful and inspiring group of speakers to guide us through this session. While we will, of course, be looking at policies and strategies, our focus is going to remain very much on the people, those who are directly affected by cancer, and on the organisations and individuals who are working so hard at so many different levels to make a difference. We will hear about the many challenges that are being faced on the ground, but we're also going to hear stories of hope and inspiration that will give us strength to aim even higher. I'm going to jump straight into the first session, which I think we can describe accurately as our panel of the people. This is where we get to hear from 3 survivors, each with a unique perspective on the subject of our discussion. I'm going to introduce each of our speakers in turn, but I'll quickly flag that we have 3, Yvonne Dunkley from Jamaica, Dr. Pintos Egesima from Nigeria, and Nadia Jamil from Pakistan. Each will speak for around about 5 minutes. We'll then have a brief discussion with the 3 panelists before opening the floor for questions from our audience. And I really encourage you to ask the questions of these 3 brave and inspirational individuals. So I'm going to begin by introducing Yvonne Dunkley. Yvonne, as I mentioned, was born in Jamaica, but she spent a large part of her life in the United States. Yvonne has a wonderful and an inspiring life story, which I will leave her to tell you. She is the founder of a charity program, Feed the Fight Breast Cancer Awareness, through which she has truly global reach in raising awareness for breast, prostate and cervical cancer. Yvonne, please. Thank you.
Ms. Dunkley, could you please accept the webcam request and unmute your microphone? Sorry to disturb you again, Yvonne. You're actually self-muted. We cannot hear you. Perfect.
Good morning, everyone. Am I okay now? Yes, thank you.
Wonderful.
My name again is Yvonne Dunkley, and I'm a breast cancer survivor. I was diagnosed on April 22nd, 2010. I went in for a routine mammogram and was told I had breast cancer. At that moment, as I sat in front of the radiologist, I was totally confused, because when one think of cancer, we think of death because of the knowledge that we have. And for me sitting there, I could not really hear what she was saying. All I could think of is death. And so after she told me I had to do a biopsy in order to know what stage I had, and all these information was totally new for me. Even throughout the years, I started my mammogram at age 35 because they said I have one of those dense breasts. So I had to start at an early age. And I did it because it was just a routine for me. I would listen on the radio about people having cancer. And it didn't really, it's something that no one wants to really listen to, because you associate this subject with death. And so for them giving me the information, I was just totally blank. A day after I went in to do my biopsy, and they told me I had breast cancer, I sat there and was just totally numb. After she gave me all the information I needed, which if you ask me today, I can't really explain what she said because I could not hear her. I went in my car, and just started to cry, and I just kept shouting, why me? Why is this happening to me? Cancer doesn't affect us. It's those people that's out there it affects. And after reaching home and I told my family, I guess they had the same reaction. I went in to do to cut my breast off. That was devastated to me because from age 13, I grew up my breast busting. This is telling me that I'm now a woman. And so it's something that we take pride in. And now someone is telling me to cut it off. So I could not understand why, but in my knowledge, but I knew that in a medical term is something that I have to do. So I followed. I just go along with the surgeon. They did the breast surgery, and then I was given 6 rounds of chemo and 35 sessions of radiation. After the chemo, I was bald. My head was bald. I could not. My biggest thing that affected me was my memory. I could not remember anything. And during the process of recovering, I would sit and started to re-educate myself. I was literally in kindergarten again. I had to focus on the words. I could not Chedisia, come here, please. Please, Chedisia, hurry, hurry. I'm gone. I don't know why I'm gone.
You're what?
I am gone. Oh, this charge was out. Will it come back?
How'd you get out?
We
I don't
can
know. It
hear
just
you.
kicked me.
We can hear you fine.
You can hear them?
Hello?
Yeah,
No.
please go on.
Okay, okay. So where was I? My head was bald, and the one that affected me most was my memory. And so I felt like I was in kindergarten again. I could not spell my name. And so I had to sit and draw the words. And another thing that came to me was that my memory has something to do with my motion or words. That so I had to draw. I want to write the word was. I had to was and try to bring back that W in order to write it. And so I found myself in a situation where I was not just numb about it, not just losing my femininity, not just I was starting all over. After the chemo, I did the radiation, which my breast, the first layer of my breast was just gone and shriveled. And I could smell I could smell the raw burning, like as if I was in a burn unit. And I sat there and I needed to, after internalizing it, I wanted to help others. I did not want to see another woman to go through this process. If there is only one person that I could help, I need to. And so I had to tap into my faith by accepting what was happening to me in order to move on. And so January 2013, after finishing my last radiation, I was devastated. I was saddened. I was dismayed. And 2 days after the last radiation, I needed to exhale. I needed to leave out of the space that I was. I felt like I was locked in. And I took the Delta airline and went to Jamaica, thinking that I would have the beach, the fresh air, new atmosphere. And when I went there and I went to church and they asked me about my experience, and I started to talk about my experience, I realized that the knowledge was not there. And I realized that this was a new arena for me, even though I could not academically, the words that I want to say, it's in my head, but it could not come out of my mouth. And so I was at a stage where I felt like I was in kindergarten, but they worked with me. And that was the good part of it that elevated my spirit, that they were able to work with me because it was something new for them. They did not have the knowledge of the stages, why they need to do the mammogram. Another reason was the economical situation that they were living in financially. Minimum wage was $6,000. Well, the minimum wage there was more than the cost for the mammogram. And so when I speak with people, the first thing they would ask is, I would like to do it, but we didn't have any money. And I was able to sit back, because this was also a learning process for me, to sit back and appreciate what life has to offer me, even though I was going through this dark world. And because in terms of medical, it was free for me. And now I realize that something that I take for granted was other people did not have it. So it teaches me also to be grateful and thankful. So even though I was going through my storm, I realized that I needed to be thankful for the situation that I was in and to use that experience and help others. So we started out, I started out going to, in the early mornings, I'd go to all the banks. I would call up the bank, the government building, the corporation, the schools, the clinics, and I will tell them who am I and what I do. And they were so grateful. Like, what time you can come in? And so I would go in early morning when they have worship, and I would talk about breast cancer. Started walks because I needed funds in order to help the people there to do their mammogram. So we started to have funds and concerts. And from that, I was able to do my first health fair. To God be the glory. We were able to help over 1,000 women to do their mammogram. We subsidized some. We gave free mammogram. And I remembered after going to a
Yvonne,
church.
Yvonne,
Yes.
if I can
Yes.
just stop you there, because I'd like to pick up in the Q&A some of the strategies that you used. So would you mind if we just go to the other two speakers, and then I'll come back to you to talk about these specific strategies, because there's really, it's unique, some of the ways that you manage to reach out to the communities. So I want to make sure that people get a picture of that.
Okay.
Okay, brilliant. Thank you so much. So we're going to jump. I just want to make sure everyone knows that we're just really doing a bit of an introduction here, a bit of a scene setting, and then we're going to come back to people and get them to unravel some of the threads in their stories. So we're going to jump to a wonderful young medical practitioner, Dr. Pintos Egasima. She works in the Accident and Emergency Department at the University of Medical Sciences in Ondo State in Nigeria. And I think through also a wonderful, inspirational, personal story that is behind her becoming a champion for cancer prevention. Please, Dr. Pintos.
Okay, thank you very much. So, like she said, I'll introduce myself again. My name is Dr. Pintos Simba, that's Simba. So I'm a cancer survivor. I was diagnosed in the year 2018 of ovarian cancer when I was just 24 years old. So that was really young for that kind of, especially for reproductive cancers. It's usually not so early in women. Usually most women are older. So the first symptoms that I was having, I knew that something was wrong, was when I noticed that my periods were getting heavier and they were irregular, and I also having this abdominal pain that did not go away. So those are signs that I noticed, and I was like, okay, this is something wrong. I need to go to the hospital and check it out. So I was able to go to the hospital. I ran some tests, and they were like, oh, they have a mass there, but there's nothing to worry about at that moment. So, but okay, and then the pain went away. I didn't worry about it till the next year, where the pain came back even worse, and I couldn't do anything. I was just on lying down in bed, so I had to get myself admitted, and that was when the gynecologist I saw said, okay, there's a tumor, there is a mass that I need to be taken out. So I had the surgery in the hospital, and it was free because since I worked for the hospital, I didn't have to pay for it, and also I got the treatment, and then they sent the samples for histology to check whether it was a benign tumor or it was cancerous. And I got the test a month later after putting the surgery while I was still recovering, and found out that it was cancerous. So that was another shock to me. Like I'd gone through like a major procedure, and then now being diagnosed of cancer at that young age. So I wanted to know what my options were. Did I need to get more treatment? What was I supposed to do after? So they referred me to an oncologist in a different state. So I was able to contact the oncologist and set up a meeting with her. So when I met with her, she also set up another meeting with a gynecologist that specializes in reproductive cancers in women. So from his reports and examinations and tests run by him, was like, I didn't need to do any further treatment, that the surgery for that kind of grade of cancer, that the surgeries are usually the only treatment needed. I don't need to do more of follow-up, comfort checks, be examining myself to take note of any symptoms that I might have later on. And so far, it's been 2 years since then. I've been fine. Everything, I've noticed like good changes in my body. Like in terms of the period, it became more normal, it became regular. I no longer have any pain. Things that were difficult for me before were now a bit easier. But my own story now, I'll call it it's a blessing. I was lucky for me because I was able to get all those care as at when due. I didn't have to wait to see the specialist. I didn't have to wait to receive any type of treatment. I can easily access the specialist care, the oncologist at any time that I need to. But that is not really the norm for everyone out there. That's not really norm from everyone out there. So there are things that we need to actually work on, especially in this year that I've talked about eliminating specific cancers that are also preventable. So one of the things that we need to actually everyone listening out there and also the key stakeholders need to focus on is also increasing awareness in young people about cancers, especially that they can also have cancer, that the language should suited to them. It shouldn't be so medical. It should be able to, and they should also see that also something that okay, older people that get, they should be able to see that okay, young people can also get cancer. So when they're making campaigns, they should also include young people talking about their own stories, talking about their experiences, so that everyone can also relate to it. Then there's another thing I also think about treatment, because there's a difference between being diagnosed and then affording treatment. Because in Nigeria or most of African countries, getting treatment for cancer is really expensive. Even if you could afford the first dose, subsequent treatment is really difficult to come by. So if we could help to get subsidized treatment for people with cancer, and also if they can, if not subsidized, but at least free treatment for people that are diagnosed with cancer, then also we also need to make that this services, especially for preventable cancers, screening should be available. Everyone should know, okay, I can go here and here to get screened for so and so cancer. So cancers are preventable, like example, cervical cancer, that there's a vaccine for it that young people can get, both male and female, to prevent them from developing cervical cancer later on, that they don't get infected with that virus that leads to cervical cancer. That's one thing that we should need to focus on. And also, basically, everyone should be interested in cancer prevention and cancer screening. It shouldn't just be, oh, I know someone that has it, or it shouldn't be, okay, I don't know anyone that has it, so then it's not my concern, does not bother me, I'm not interested. It is a really important issue, especially for a disease that can actually be preventable, can actually be cured and preventable, something that everyone should really focus on and think about on how they could help in their community, in wherever they work, just creating awareness and also helping to subside for treatment. So thank you very much.
Thank you very much, Dr.
You're
Egasimba.
welcome.
What you bring out about the importance of equity and access to both diagnosis and treatment, I think that's something that we'll definitely take up in the discussion period, because it's so central to the broader issues that we're bringing to the table today. I'm now so happy to introduce Nadia Jamil. Nadia is British-born Pakistani, an acclaimed actor, teacher, motivational speaker, and a very active advocate for child protection in both Pakistan and the United Kingdom. Nadia uses her many platforms so effectively to motivate and inspire those who've been affected by cancer, depression, and other mental health challenges. Nadia, thank you so much, please.
Hi, and it's a privilege to be here, and it really rung true listening to Yvonne and Dr. Pintos. I was diagnosed in March 2020 in the thick of COVID. I live alone with my youngest son. My older son had just left to join his dad. So it was just him and me. And initially I was very gung-ho and I thought I could take it on. And my father has had cancer. My grandmother passed away, cancer. My cousin has cancer. I seem to be surrounded by cancer. So I seemed to take it on, okay, in the beginning. And when the scans start happening, when they start testing your liver scan and various other scans, that's when I started getting frightened. And by the end of April, I was extremely depressed and I tried to take my life. And my son, my little 13-year-old, he saved my life. And after that, my chemotherapy began. I think really after the chemotherapy began on the 1st of May, everything was just really matter of fact. The session and I lost all my hair, I lost my nails, I lost my eyebrows, I had ulcers in my mouth. I'm an actor for South Asian TV networks. Having no hair is not an option. A lot of people told me I don't look like a woman anymore. Some people referred to me as a monkey. I started sharing my journey on social media because I really didn't have anyone else to speak to. And I got sepsis. I was isolated in the hospital for several weeks. So I started sharing everything on social media, and it was unbelievable how women started talking back to me about how they have felt and fought during cancer, and how they have battled depression, how they have battled rejection from their husbands, how they have been ostracized by societies. And it was amazing. It was amazing to hear these brave women speak out to me, and I knew I wasn't alone. I think it's important to speak about the gender perspective because women and our identity is so deeply enmeshed with how we look, our hair, our breasts, our makeup. It's all a part of who we are. And I think when it's all snatched away really suddenly and very brutally, you sort of lose a sense of who you are and what it means to be a woman. So I think that has to be restructured and re-recognized because I am no less of a woman than I was before. And I think it's important for women to receive counseling. Counseling is such an important part of it because after the treatment ends and the battle really begins after that. What you have to live with really begins after the treatment ends. So, I mean, obviously there are the obvious things like accessibility to medicine and screening. And I mean, I got caught early because I self-examined a lot. My lump didn't come out in my mammogram because it was to the back of my breast. So those are the absolutely essential, obvious things. But the second thing is, I think, counseling and mental health. and the pastoral care that needs to come with cancer, because the NHS was phenomenal. I did not feel I was alone. I did not feel like there was nobody with me. They were really fantastic, and I really thought a lot about my sisters in Pakistan who don't have that kind of pastoral care, who don't have somebody explaining that it might be okay, that these are your options. So I thought that was very important. I also feel that awareness is, like Dr. Pintos was saying, awareness is extremely important. Connecting to people on social media, having these amazing chat groups where women, all of us got together and talked. But that was all over here. In Pakistan, there are no such groups available to women. I mean, internet is not available to many women. So, I mean, if internet is not available to you, how do you connect? How do you meet other women who have cancer and who have suffered what you've suffered? It's a question of going to village, town to town, and talking to women and telling them you're not alone. And most importantly, I think the mental health care, after my cancer treatment ended, I battled depression because I had 1 month of radiation, and then I have 10 years of hormonal therapy. The hormonal therapy obviously caused huge mood swings. Then there's early menopause comes in, so I have arthritis now. I'm also diabetic because of the chemotherapy. So I think it's suddenly you're like, hello, I'm just a big bag of, sicknesses. And that's after the cancer treatment's ended. That's after everybody's telling you, hey, congratulations, your treatment's over. And you can't walk, and you have diabetes, and you're depressed. So I think a lot of the care needs to continue after the treatment is over. And it's important to reach out to women who do not have access to the internet, who do not have access to social media or televisions or cable even. It's very, very important to get to those women and tell them it's okay. Most importantly, in Pakistan, I had a huge problem speaking to young people because of the word breast, because it's been so sexualized that it was difficult to speak to a school or university students and say breast cancer without a lot of giggling. And a lot of women are just ashamed to say the word breast. It's ridiculous. I think it's time that women own their bodies and are given their bodies back, given that language back. The sexualization that occurs all over the world, we need to challenge that. And it can be done. And most importantly, it's important for these women to know cancer is not necessarily a death sentence at all. So that fear that Yvonne spoke about, that all of us have, that I've had all my life, even before being diagnosed, that fear of this big word, cancer, the big C, I think that also needs to be challenged. I want to go around telling people, I have had cancer and I may have it again, and I'm okay. And the thing you learn, and the great gift that cancer has given me, is you learn how to survive, and you don't take survival for granted.
No, what a wonderful way to end a very powerful intervention. Thank you so much, Nadia, and also to our other two panelists. I think this is such a humanizing way for us to begin our discussions today, and a great reminder about putting people at the center of our thinking around what needs to be done. It's so easy to get lost in the data and to get lost in the science, but at the end, it's about people, and not just the survivors, of course, but also the families, and the ripples go out far and wide. And Nadia, I think you did a wonderful job of bringing that really to life for us. So I'm going to put our wonderful panelists on the spot and ask each of you, starting with Yvonne, if you don't mind, what's the one single insight you would like to share with us about what worked or what works when it comes to raising awareness What have you learned? And then I'm going to ask the same question to our other two panelists as well.
I have learned to be thankful in everything, because the things that we take for granted, it's another person's challenge. And it was through this situation that, even though I could not read and write again, I was able to write a book. The name of the book is Smiling Through Breast Cancer. I needed to show a positive outlook, and not just cancer, but any situation that we come across, that there is a light at the tunnel. And I was able to use my faith to take me through this journey, and was able to share to others and help others. And this was one of my ways. This is how I met Lane. I was in Jamaica, and I went to a church, and I was talking about the signs and symptoms about cancer. And this lady stood up and said, I'm having pain in my breast. And so I took her from where she was into the city to take a mammogram. After she was finished, they told her she had breast cancer. And I had no money. Absolutely nothing. I was devastated. It was as if someone telling me again that I had breast cancer, because I know what the challenge is going to be for her moving forward. And so I needed funds, and I just started to think of ways, and I thought of coming to different countries, just talk and ask for donation. And this is how I met Lane at Brixton in London, when I came there to just share my testimony. And so I was able to meet people from a vast, the global,
Thank
and
you.
I'm thankful.
Yeah. No, that's wonderful, and I think it's a really such an important message for us all to take in our hearts. The gratitude, and compassion that must accompany us on this journey. Thank you for that. And I think that this must resonate with so many people listening to this. That's really very meaningful. Dr. Pintos, what's the single insight, the thing that you feel, whether it's a strategy or a particular realization that you've had, that you feel that should be shared with those who are trying to work to raise awareness, to bring these issues to the fore?
Okay, so I feel that one particular strategy that could help to raise awareness about cancer is basically just we need more like private and public sector funding, like partnership, to make sure that that everyone has an idea of what's happening. It's not just related to one particular set of people. There are also cancers that affect different age groups, from young children to elderly people. So one way is that there should in every type of cancer, or in talking about cancer, you should not just focus on a particular age group or a particular gender. It should focus all around, so everybody can know, okay, anyone can have cancer, and then this is what they should do, or this is what they can reach out for. Like all the places or the center should be friendly for everyone, should be open for everyone that can receive that. It should be available, that everyone should be able to receive those services. That it shouldn't be, okay, you have to be a particular class, or you have to be a particular kind of person, or you have to be a particular kind of race or something to receive treatment. That treatment should be free and open. The strategy is that simply it should make it accessible to everyone, and that requires money. And so it can't just be only private companies or public companies. It should be a partnership in between the two of them to raise that awareness and also ensure that people get treatment that they deserve.
Yes, thank you. Thank you very much for that. And I think we're going to be picking up both of these issues, including the point that you made about public-private partnership, about the idea that this is not something that should be the domain of one generation or of an older group of people, that this is truly an intergenerational issue, and we need bring everyone together. I think that's so important, and both of these issues I'm hoping are going to be taken up by other speakers. Nadia, what's your insight? What's your golden ticket to great awareness? And
two really important things Yvonne and Dr. Pintos have mentioned, and I think that they're really, really essential. Gratitude, and definitely it gives you a sense of positivity and accessibility to, I think, to good care, like Dr. Pintos was talking about. Two things that I think are very essential is, one, the mental health care of patients and their families, because like I said, cancer is not just the cancer, it's everything that the treatment brings along with it. And secondly, the language on how we talk about different cancers, so that they encourage early intervention, so that we encourage young people, women, to go ahead and learn that self-breast examination, to go ahead and take that vaccination, to go ahead and, as Dr. Pinto says, once they know and once the screenings are accessible, they should actually go to it. How do we make people actually go and check themselves? So for early intervention, a problem in Pakistan is breast cancer is caught generally in the 3rd and 4th stage. Even then, women don't want to go for treatment because they're so ashamed of the stigmas that are attached to it. What is it that will encourage people to go ahead and take that early intervention? I think the language around cancer needs to be less dark and needs to be less deathly. We can survive it, and it's okay to show a smiling woman with cancer. And I think Yvonne and Dr. Pintos have beautiful smiles. They speak for themselves. So I think a lot of the advertising about cancer and around cancer to encourage early intervention could be a little more positive, perhaps.
thank you, Nadia. Thank you so much. And what I took from that was the reminder again that, of course, we must focus on the physical aspects of this disease, and we must focus on the physical aspects of the treatment, but the psychological, the mental burden that you explained so well, I think it must figure in how we are developing and implementing approaches. Thank you so much. Please.
I just want to finally say the one thing that obviously the treatment itself is expensive. Having cancer means you're not working. Having cancer means you don't have a job. So the financial implications are huge, and that adds to the depression. It adds to the feeling useless. So
it's very true. When we speak of economic impact, we're quite often speaking about the impact on national health systems, for example, but it's too easy perhaps to forget that there is also that individual impact where the diagnosis of cancer and everything that happens after that shatters lives and shatters families and creates great hardship. So thank you so much for that. And you know, I feel like the language issue is also so important, because I think about meetings that I was at 20 or 30 years ago at the United Nations, and even the way that you have engaged, the language that you've used, the frankness and openness that you've brought to this conversation, I think we are already in a different era, and we must just persist with that. We just must make sure that this is a trajectory that we move down. So I'm going to leave with a sense of great gratitude to the three of you for sharing your story, and not just for sharing it, but for, I think, doing something really irreplaceable in making sure that the rest of this session is on the road that we need it to be on, which is a road of humanity and compassion and love. So thank you so much. And colleagues, I'm going to jump right in to our next session without further delay. I think we're doing fairly well with time, but we did start a little bit late. Yes, we started a little bit late, but we're just about to go to now the civil society perspective. So the perspective of the organisations, the individuals who are really at the front line in advocating for improvements, for changes in how cancer particularly, but not only cervical cancer, is being dealt with. We have 4 wonderful speakers for this as well. We have Alan Maleche, who's coming on almost straight away. And actually, I'm just going to introduce them all in turn. So I'm going to begin with Alan, who is an advocate of the High Court of Kenya with really such an impressive record in defending human rights and working for vulnerable and marginalised populations across so many different issues. I think we're very, very grateful to have Alan here. He sits on the UNAIDS Human Rights Reference Group and has really been very closely involved in the governance of the Global Fund. Alan, please, looking forward to your presentation. Thank you.
Thank you so much, Dr. Gala, for having me and the organizers. I just want to acknowledge the 3 speakers before me, Yvonne, Dr. Pintos, and Nadia, who I must say are very brave people to be able to share their stories, but also put into practice to help others not to go through what they went through. I'm just going to make a very short intervention that looks at 3 areas that relate to what has to be done, what needs to be done, and what we're doing as civil society. I think the stories by 3 lovely and eloquent women demonstrates that we must live up to the commitments our government signed up to in a number of high-level meetings. I begin with the Universal Healthcare Coverage high-level meeting, where commitments were made by our governments to strengthen efforts to address non-communicable diseases as they address issues of universal healthcare coverage, and recognizing that it's important to engage people, particularly women and girls, families and communities, in the components that are relevant to the health system. And so I think the first point for us is to realize what are the commitments government has made and how can governments work towards these commitments to ensure that women and girls do not suffer from cervical cancer, or the general population is able to protect themselves from their health, because building the block of universal healthcare coverage allows us then to get the fact that we are dealing with health from a broader perspective and not only dealing with it from a singular disease. So for instance, we know from our HIV work that cervical cancer among women living with HIV is quite high. And the likelihood for a woman living with HIV to develop cervical cancer is 5 times higher than that for a woman who's not living with HIV. So this basically tells us if you address your health system, you can't be doing well on HIV while not integrating sexual reproductive health rights services to allow women to be screened earlier. So we need to see how do we take a holistic approach to strengthening our health system, not only for people to be able to access services, but to drive the message of prevention, to drive the message of ensuring people are not becoming poor as a result of having to take their treatment. And so the UHC Dream provides an angle to be able to get through this. I think the second point for me is to think through how do governments make smart investments and ensure that investments go towards those who are affected, to the communities, because it is from the grassroots going up that you're able to ensure that we get the right messaging, we deal with the stigma that Nadia was talking about with regards to how people perceive those who have cancer, to be able to ensure that people embrace community approaches in terms of being able to promote preventive behavior, to ensure that people access diagnostic services, to ensure people live healthy lives, to ensure that people have access to healthy diets that reduces their chances to get cancer, and even access to physical exercises. So a holistic approach in terms of looking at these issues is extremely important, and we must strive as members in the Commonwealth to see what is our collective response in terms of providing a holistic approach towards addressing the right to health. I want to end by saying, just in this phase, that we really have to dig deep through and say, what are the legal frameworks we need to put in place? What are the policy frameworks we need to put in place? And it's not only about putting the legal and policy frameworks in place, it then comes to how then do we give them life by putting budgetary allocations, how do we give them life by making investments both in different sectors, be it the private, the public, civil society and community sectors, and how do we also empower judiciaries to be able to interpret the laws and the policies and to also provide guidance where rights are being violated, because we see that happen. So it is extremely important for us to be able to see how do we use our legal framework, how do we use our policy framework to address the inequity and inequality that Yvonne talked about, to address the stigma and discrimination that Nadia talked about, to address the fact that whether it's a young girl in Kenya who's living with HIV is able to have access to a vaccine, because we know, particularly for cervical cancer, it's preventable, it's curable if diagnosed early in treatment. So what can we do globally to be able to ensure that we are preventing young girls from getting HIV, while at the same time ensuring they don't get cervical cancer, by ensuring there's right treatment, by ensuring vaccines are available, by ensuring information is broken down to them in a manner they are girls with disabilities, whether they're young girls, and I think that's the approach we need to be taking as we move forward. And as civil society organizations, and as I finally conclude, Dr. Gala, as civil society organizations, we definitely must work hand in hand with those who have been affected by cancer. Putting people who have been affected at the center of the response is extremely critical. We can't work for them, we must work with them. And Yvonne, Nadia, and Dr. Pintos have actually demonstrated that when you work with the affected people, you get better results. And that's the mantra both civil society, governments, private sector, donors, development partners need to forge forward if we are to win the fight against cancer. Over to you.
Thank you. Thank you so much, Alan. And there was so much in your presentation, really. I think that the final point that you made may well become the mantra of this session, that we must, at every stage and at every level, put affected people at the center of our response. And like you, I thank our three introductory panelists for reminding us so powerfully of that point. And Alan, another very important point that you made that I feel really deserves to be amplified is that it's so critical that we get the legal and policy framework right, but that's just the beginning. So we need to empower our national institutions to ensure that the legal and policy framework is actually implemented. We need to make sure that the budget allocations are appropriate. We need to bring in the private sector as that's possible to make sure that they're part of the response as well. So to give life to these laws and policies that are so important. And thank you as well for reminding us that human rights, of course, cuts across everything, but there's so many aspects of this particular subject where issues around discrimination, issues around inequality, issues around right of access and the right to health are very real and very pressing, and they need to be, many of our issues that we're talking about need to be thought in the terms of human rights. Thank you so much for that. We now have, I'm so happy to welcome Maud Wakan Sungala. I'm so sorry, Maud. A champion in so many ways, a health advocate for the prevention and control of women's reproductive cancers, especially breast and cervical cancers. Maud's truly been instrumental in developing national efforts to improve cancer treatment and care in Malawi, focusing especially on rural women and girls. And I think we're going to be hearing more about that now. Maud is, I don't know how you have the time, Maud. You are on so many boards and leading so many committees, so I won't go through them all, but suffice to say that you bring to this discussion so much experience and leadership. Thank you.
Thank you very much. I just want to thank the panelists before me, that is Yvonne, Pintos, Nadia, and Alan, for highlighting what is actually happening with cervical cancer, especially to our survivors. That is a very great thing that you've done to come in the open. This actually helps a lot of people. What I just want to highlight mostly is on addressing issues around awareness, stigma, and care for our people. And we work with the grassroots levels, that is people in the rural areas. So what I'd like to talk about is that we have partnership with the government where we complement the efforts that they're doing. We are looking at three things. We're looking at information we should get to the grassroots people. And then we're looking at influential leaders in those communities who can actually help us get the message out to the people. And on the other hand, we're looking at quality services which these people can actually get. That's the women in these communities. So what we actually have, we have one project which we're doing in the meantime, where to get this project, we look at bottoms up. That means we start from the communities and then it comes up. So what we did is we actually went into the communities to find out what they're doing, and they were able to help us to give us information. So at the end of the day, we get connected with the district hospitals where they're able to give us this information and look at where the highest prevalent rates are of cervical cancer. So we are dealing with a district like where we stay, it's called Lilongwe, and they were able to give us information on which area they have been high prevalent rates, where women present late. They come with cases which are already lost. So we were able to get into these communities, and they have community hospitals in those areas. So when we get into these areas, we don't go straight to the communities. We first go to the community hospitals where they're able to give us information and how we are going to work in these communities. So what happens when we work in these communities, we have meetings with the hospital management, and they call in the chiefs, where we actually have discussions on how we can work out and bring the awareness information into the communities. Then eventually we're able to go into the communities and then meet the chiefs and whoever is responsible, even the clinics which are working around those areas. So in this area, which we're working, is called Kabugula area, and then we are working with almost 9 satellite clinics, and we have the main hospital, which is called Kabugula Community Health Center. So what we're doing there is actually that we are able to provide them with consumables and everything, where they're able to test women. So we go into these places, we go with awareness education, and we tell them what is actually happening. We try to demystify the whole information on cervical cancer. That means we're actually working with the health workers in that area. And then what happens there is that we usually have integrated services where we have women who are coming for ART clinics, or they've come for under 5, they've come for family planning. So we tap from that community, and then we're able to give them a talk. When we give them a talk, then you find that a lot of women are actually willing to have screening of cervical cancer. And most of the time, once they are told that maybe it might be positive, not that they have cervical cancer, they're able to say that they will have themselves treated with thermocoagulation. So we have that working relationship. Then we actually do training with the influential leaders, which are usually the chiefs or the religious leaders. We're able to talk to them, and we try to train them time and time again on the information on cancer, because they're the gatekeepers, they're custodians of these communities. They're able to tell the women what to do. They're able to approach the families. They are the ones who start with the community dialogues, where people should be able to discussing about cervical cancer. So after that, we move on to the health centers themselves, because as we said, we are working with satellite clinics. So in these satellite clinics, we are able now to discuss with them on what is happening on the ground, have weekly meetings or monthly meetings to see how we're actually going. Most of these clinics have asked us if we could, they want the projects, when we start them, they should be sustainable, because usually we can run a project for 1 year and have all these cervical cancer screening and treatment, and then we happen to leave the area and they find that they cannot continue. So their request is usually, can there be knowledge transfer, where I think the health people in that clinic would like to get training, so that when the project goes, they're able to still screen the women as they come in. So that is something which is sustainable at the end of the day. So what we usually do is that maybe we have only funding for consumables, which you can be able to supply to them. We go for gap funding from other donors if they can come in, so that that project is actually sustainable. So at the end of the day, working in that area, we have found that like per week, we are able to maybe screen almost 40 women, which is, when you look at it, when it comes in a month, that's almost 160. We feel that that is actually making a difference on the ground if compared if we didn't go into that area. And then when we start having these women coming in, we have women who have like actually screened, who become champions, who now tell their friends and demystify the whole thing on cervical cancer, because there are a lot of complaints which go around with people talking about things which are happening, saying that they don't want to be checked because they feel that when they get screened, usually they get problems when they have that. So we have all those things going on. Thank you very much.
Thank you so much, Maud, for that. And this is such an important perspective, the perspective of how we engage at the community level and the very different needs that exist at the amongst rural communities, and how strategies need to adapt to meet those needs. So thank you very much. I think we'll be coming back to you in the discussion session on this particular point as well. Colleagues, I'm now going to introduce Dr. Monica Arora, who's a public health scientist from India working in the area of health promotion and health advocacy with a focus on prevention and control. It's so good that we've got Monica with us. She's truly a world-leading and award-winning researcher, leading multiple organizations and programs devoted to health promotion and disease prevention, focusing especially on non-communicable diseases, and really with a global reach, Monica, because you've had, I think, so much exposure to international policy development. So thank you so much. Very much looking forward to your presentation.
Dr. Arora, apologies. If you could please unmute yourself as you're self-muted. Thank you.
Thank you. Thank you so much, Anne, for that kind introduction. I think after the excellent speakers at the survivor and patient session, this session, which is more evidence oriented and what civil society has been doing, may not be that glamorous, but I'll try to make it interesting, as our earlier speakers have done in this session. So briefly, I'll be sharing experiences from India and drawing in some of our experience that we have learned globally on civil society engagement. So while we do want to highlight the gaps and solutions in cancer prevention from civil society perspective, I would like to begin with talking about cancer burden in India more generally, because we are talking at the London Global Cancer Week, and cervical cancer, as we have been hearing, is the prominent theme. But some parts of the world do have other cancers also very prominently challenging the health system, and I'll briefly talk about that as well. So our National Cancer Registry Program Report 2020, released by the Indian Council of Medical Research, has recently shown that about 1.39 million cases of cancer in India are estimated in 2020. And this number is likely to rise to 1.57 million by 2025. So definitely underscoring the need to highlight our efforts, not just on screening and prevention, but also treatment as well. Most of the part of this report also highlights that 27% of the India's all cancer cases in 2020 will be tobacco related. And that has been the principal risk factor for most of the cancers in India. And that's primarily because of the smoking forms of tobacco products, but also smokeless forms of tobacco products, which are used in the subcontinent of Southeast Asia region. The report also highlighted that cancer of the lung, mouth, stomach, esophagus are the most common cancers among men, while cancer of the breast and cervix are the most frequent cancers among women. So as per the report, lung cancer was the leading site for cancer in metropolitan cities and in the southern region of India, whereas mouth cancer was the leading site in West and the Central region. So apart from not just dealing with one type of cancer, we all are dealing with multiple cancer problems, and therefore we need a strategy which is multi-pronged. Also, talking more about tobacco-related cancer in India, as I said, that this has been a humongous burden, and the government of India has implemented National Tobacco Control Program and also has enforced a Cigarettes and Other Tobacco Product Act. So what Alan did talk about in his presentation about the role of policy and legislation is very, very important, and civil society particularly needs to highlight these aspects when we talk about cancer prevention. The Cigarettes and Other Tobacco Product Act is in line with WHO's Framework Convention on Tobacco Control, and civil society has played a huge role in ensuring that country follows best practices in tobacco control when it comes to policy issues. And to that effect, the CSOs like Hriday, where I belong to, has worked very closely with civil society and the government. And the kind of activities have ranged from research, capacity building, and awareness among community as well as youth on tobacco control and non-communicable disease prevention and control. So just to briefly introduce, Hriday is an acronym for Health-Related Information Dissemination Amongst Youth. And also Hriday means heart in Hindi. With that name, it is very evident we work on NCD prevention and control. Also, I would like to highlight that civil society has been active on ensuring accountability, transparency in policy making as well as policy implementation. Hriday has been very active in the research arena as well, and that is the reason we have been able to get some seats on the advisory committees at the national, at the international level, because our approach has been research to policy action. We conduct research in community settings. Once we show effectiveness of health promotion interventions which target prevention, it's only then we work with the government in upscaling those interventions and getting them included in the national health programs. So this experience of Hriday in ensuring research gets translated into policy action underscores the crucial role that CSOs can play in cancer prevention as well. Also talking about Hriday's presence with civil society and close working, we serve as the Secretariat for Advocacy Forum for Tobacco Control, a coalition that mobilizes concerted civil society action on policy issues. And it also now serves as the Secretariat of the Healthy India Alliance, which is the India NCD Alliance. And our work, our NGO work and our members work on cancer screening, awareness, and treatment, including palliation. We work with people living with non-communicable diseases and are informed by their expertise. And we are working on meaningfully engaging them so that they can be brought to the decision-making tables because they have tread that path. And what we heard today was an excellent example of why they should be there on the decision-making tables and they should not just be the beneficiary. So we are conducting activities with the government, making these suggestions that we should meaningfully engage people living with NCDs and youth as well in all health and development agenda. Talking specifically about cervical cancer burden in India. So in 2018, India reported 97,000 cervical cancer cases and 60,000 deaths, which was highest estimated number of cervical cancer deaths in the world for that year. Again, to address that issue, we have government programs, national cancer control programs, secondary prevention of cancer of the uterine, cervix, mouth, breast, etc. However, the guidelines for the screening program do highlight that we need to have a multi-sectoral working. And talking about gaps, I would like to highlight here that from a civil society perspective, we feel that adoption of multidisciplinary approach towards cervical cancer control and prevention is a gap. We still need
Monica,
to work.
I might just jump in there and just because we've still got 2 more speakers, but what I'd like you to do is in our discussion period afterwards, if you could take up this issue of a multidisciplinary approach, really in the context of on the basis of all of your experience, which I think ranges so far and so wide. What is, I know that there's no magic bullet, but what is the one thing that if it was done more consistently and really understood by everyone involved would really make a difference? So I'm going to come back to you with that very specific question. Thank you so much. And colleagues, I'm going to now introduce someone. I think it's fair to say that Dr. Owen Gabriel is St. Lucia's national champion on cancer prevention, awareness and treatment. He's the National Cancer Control Coordinator and represents St. Lucia in regional and international fora. Like our last few speakers, I think that the list of both accolades and positions would take us through well past our finish time. But I did want to say that Dr. Gabriel's work on establishing national cancer registries and on public education on cancer has been especially critical and is so important to our discussion here today. Dr. Gabriel, please.
Good afternoon, everybody. Thank you, Madam Chair, for your gracious introduction. I think in order to accomplish the goals set out for this event in the context of the Caribbean, it's important to answer 3 key questions. The first is, do we really know the true status of cancer in the Caribbean? Then we must discuss the goals of cancer control and what exactly we need to do and how we may engage key stakeholders to address this mammoth public health problem. Finally, we need to explore what are the most viable options to achieve these lofty goals. To answer the first question, we know that historically the majority, if not all, of the epidemiological cancer data reflected in global data sets are only extrapolations or generalizations for third world or developing countries. Most of the Caribbean countries lack robust population-based cancer registries to inform current or transitioning trends of incidence, prevalence, genetic profiles, risk factors, and efficiency of health services. In reality, international datasets have failed to represent the dramatic shift in the cancer burden of the Caribbean. We have been delegated to the pool of cancers that are etiologically associated to fundamentally chronic infectious illnesses. These include cervical, liver, stomach, oropharyngeal, and esophageal malignancies. By contrast, as we can see, empirical data suggests that for the Caribbean in particular, our burden is not dissimilar to that of the developed world, where lifestyle practices, especially smoking, dietary and hormonal etiologies result in a high incidence of cancers of the lung, breast, colon, and prostate. Sadly, what we do have is a combination of both these groups. Another paradigm shift noted in our region and discussed by one of our survivors today is the younger age group affected, especially in the case of triple negative breast cancers in young women who are often the principal breadwinners of their families. What of the large proportion of patients who present in advanced stages, unlike what obtains in developed countries? It stands to reason, therefore, that we must tailor whatever interventions we implement to meet the realities of our cancer burden. So we must know what our true burden is. Also, if the developed world and the developing world is expected to record 70% of the 20 million new cases this year, we must implement a strategic intervention to develop or strengthen cancer registry systems in our region through capacity building and the training of personnel in strategically positioned cancer registry hubs to speak a common language for shared data. We cannot stop there though. Research on its own is not enough. We must ensure that this epidemiological collated data feeds into the highest political and legislative structures at the center of our healthcare systems. So what are the pillars of cancer control in our region? What goals do we have? We have already discussed the need for specific, site-specific context and research but not just research for its own sake, but to develop a culture of evidence-based decision-making and policy development. This will become the basis to determine national and regional health sector priorities, to tailor resource-based guidelines and interventions on specific target populations. Ultimately, we will be able to prioritize, to educate and improve awareness, to prevent or mitigate risk factors, and to implement care and treatment. Implementing culturally sensitive policies to improve awareness and nurturing access to care across primary, secondary, and tertiary levels are the fundamental pillars to achieving prevention and control of cancer. We must eliminate all barriers to cancer care. There must be a smooth transition of patients in their communities all through the entire spectrum of treatment. We need to rethink the top-down approach, which is implemented generally in developed nations, and engage the grassroots organizations through empowerment. It is only when all stakeholders embrace this task by taking ownership of the process we will make a significant impact. Government, corporate societies, civil society organizations, and other NGOs must join forces through public and private sector partnerships, as has been alluded to earlier by a number of our panelists. The Healthy Caribbean Coalition, HCC, is a civil society organization which we represent here today. It has undertaken a pivotal role in reducing the burden of NCDs in the region with its campaign to curtail obesity in children, to improve healthy nutrition across the region via targeted initiatives like advocating for eliminating sugar-sweetened beverages in schools, supporting the implementation of front-of-package labeling. These among others. Cervical cancer is the second leading cause of cancer-related death among women in the Caribbean. The HCC has identified cervical cancer as a priority for almost a decade now, when in 2012, the HCC joined forces with the American Cancer Society and collaborated with the Australian Direct Aid programs. Together with local cancer societies, HCC has brought cervical cancer screening and HPV vaccination into hard-to-reach communities across the Caribbean in Belize, Guyana, Haiti, Jamaica, and Grenada. The HCC will prioritize coordinated actions in support of the global strategy as part of its core work over the next decade. Access to essential cancer medicines and technologies poses major challenges in the Caribbean for both adult and pediatric cancer patients. HCC recently undertook an assessment on access to essential NCD medicines in the Caribbean to inform a people-centered, patient-led civil society advocacy agenda to improve access to NCD medicines. The report found severe deficits in the area of access to cancer medicines. Also, palliative care must be a deliberate component of care to alleviate suffering of both the patients who mainly present in advanced stages and their families. This is specific to our region, the advanced stage presentation. We must collaborate to teach specialists in this area, incorporate palliation in general medicine care guidelines, and strengthen existing facilities. Finally, how do we achieve this? Sustainable cancer prevention and control necessitates a whole of society response. Government should provide the framework of policies to support prevention and control. Health professionals, scientists must work as a multidisciplinary team. Program management, CSOs, NGOs, religious groups, parents, teachers, students, ordinary citizens must act together towards this common goal. Civil society organizations need to be empowered to advocate for these policies, which will improve cancer prevention and control. A concerted global response is required to effectively address the expanding burden of illness in a specific context in the developing countries of the Caribbean. This is a role that could be led by the Commonwealth Secretariat. It is time to act. Efforts should be a joint collaboration of public health organizations and grassroots stakeholders. We need to expand on existing infrastructure and build on already existing successes. Emphasis on education, creating or improving access to vaccines like HPV, screening, prevention, and treatment with state-of-the-art radiotherapy and cutting-edge chemotherapy is key. The goal, I dare say, is ambitious, but is achievable.
Thank you so much, Dr. Gabriel. That was wonderful and inspirational. And I think that we now have this thread coming through this session of the need for really everyone to work together. We talk so much about a multidisciplinary approach, but I think you've been able, you with other speakers have been able to show us what that looks like in practice and what a great difference it will make. So thank you so much. Now, wonderful speakers of this session, I hope you don't mind if I keep you on hold for the moment while we go to our next mini session, and I'm hoping we're going to have enough time to come back to you to be able to pick up on some of these themes. And really this idea of there's so much to be done, but with your experience and with the insights that you've gained over the years, what really are the key things that we need to focus on? And if we don't end up having time to be able to explore this completely, I really encourage you, whether through there's different ways through the chat function or even as a follow-up, that we get this insight from you, because it's just so important. Now, I'm going to move to a very important session that we have here, which is about public-private partnership, using the case of Sri Lanka and the project to eliminate cervical cancer in Sri Lanka. And for this, I have Nirmali Samaratunga, who's from Rotary International in Sri Lanka. She's actually the president of the Rotary Club of Colombo. She spearheaded and continues to chair Rotary's flagship project, the Cancer Prevention and Early Detection Project, which was launched, I think, more than 15 years ago. To date, under this project, almost, I hope Nirmali, you're going to have to check that this is not a typo, that 80,000 women have been screened for breast and cervical cancer at no charge. Please clarify that I don't have one too many zeros there. That's so inspirational. Just in a couple of minutes, if you can just tell us about this initiative, that would be wonderful. Thank you.
Okay, thank you, Anne. I've got my presentation, which I will share immediately. So thank you for inviting me. It's a great privilege to be on this session. And I will try very quickly to give you a brief outline of the Cancer Prevention and Early Detection Project, which we are carrying out in partnership with the Ministry of Health Sri Lanka, and particularly to focus on the second phase of the project, which we are just embarking on, which is to eliminate cervical cancer as a public health problem in Sri Lanka. So there we are, the first slide, which shows the historic signing of the MOU. This is the most recent milestone in our project, where Rotary formalized the partnership with the Health Ministry to jointly work to make Sri Lanka cervical cancer-free by 2030. As I said, this is the second phase of the project, which, as Anne, you correctly mentioned, was launched 15 years ago. And what compelled us to look at early detection and prevention is when we found out that the high morbidity and mortality of cancer is due to the late presentation, basically in stages 3 and 4 to the health authorities. But what really drove us to look at this project was that 1/3 of all cancers are preventable and another 30 to 40% curable if detected early. We realized that we could save several thousand lives every year with a project which would focus on screening, early detection, and follow-up treatment, as well as prevention. And so 15 years ago, we launched the Cancer Prevention and Early Detection Project, which was basically to set up a standalone facility completely dedicated only to screening, early detection, and prevention, which would be, the services would be offered entirely free of charge. It would be accessible to the general public with particular focus on the marginalized and the less privileged. And it would be basically where Rotary would come in with providing the building and the equipment, supporting the public awareness and education and training, and the National Cancer Control Program of the Ministry of Health would carry out the operations of the clinic. So this is the clinic as it is today, and we have the fully fledged breast cancer screening unit, which was equipped by our major donor, the Rotary Club of Birmingham in Alabama. And on the cervical cancer screening, which is more the focus today, we have the pap smear screening, as well as with that, parallel to that, we have introduced HPV DNA testing as well, and diagnostic screening of cervical cancer through the colposcopy facility. We also do an oral cancer screening facility, which is, as oral cancer has the highest incidence amongst males. So this center, in addition to screening, early detection and prevention, also carries out through its health education unit, public awareness programs, education. We have a mobile screening facility to reach the interiors, and we also have recently launched a palliative care facility to reach out to terminally patients and their families and offer them counseling. These are the results to date. You are right, 80,000. I've been very specific here. This is a slightly older presentation. 76,000 plus, but at the moment it's touching 80,000, largely primarily females who have been screened. And of that, what is more significant is that we have cases of around 22,000 who are identified showing abnormalities requiring further investigation. These are cases which may have gone undetected. They had not presented themselves for screening at our center, and these lives could have been lost. And I think this is really the compelling force which has driven us to persevere in our fight against cancer and move on to the next phase of our project, which is to make Sri Lanka cervical cancer free by 2030 with a shared vision in hand with the Ministry of Health. The vision is up here: to eliminate cervical cancer as a public health problem, and for the women of Sri Lanka to be free of the morbidity and mortality associated with cervical cancer by 2030. There were compelling facts. It's the second highest of all cancers in females, 10%, it accounts for 10%. We have 8.21 million females who are at risk of developing this. We have 1,800 cases diagnosed every year, comparatively small compared to our neighbor, but of course we are a small country. But what is most tragic is that we have 700 people who lose their lives every year to a cancer which is both preventable and curable. We have the HPV vaccination, and we have screening, early detection, and with treatment of precancerous lesions before they develop to a cancer can actually prevent mortality and morbidity in cervical cancer. So in terms of the project that we embarked on, what we found, some of the key issues that we needed to address was the low coverage, the low proportions who were presenting themselves for screening, primarily due to the stigma, due to not understanding the gravity of the need to be screened for cervical cancer, and also because of the highly personal nature of screening, the testing which required taking a sample, kept the target group away from the well-woman clinics where they are screened. There was also the problem of delays in obtaining screening results, which we had to address, where because of the shortage of cytoscreeners, we would have to address the fact that results were coming in late, which meant late diagnosis and late treatment. Also the lack of accessibility to screening in certain remote areas. These were some of the things that we looked at when Rotary got involved in the second stage of our project towards elimination of cervical cancer. But on the positive side, the strong commitment of the government, strong public health policies, and the Ministry of Health who already had a plan, drawn up a plan for cervical cancer prevention and control. They'd already started with the HPV vaccination program of the 10 to 11-year-olds. And we have a very well-structured healthcare system, a network where we're able to reach down to the grassroots level, combined with a high literacy rate of over 90%, which enables us to carry the message in terms of behavioral change to persuade the target high-risk group of the 35-year-old females to present themselves for screening. These are asymptomatic people, which is why there's a reluctance where they don't think it's necessary and they don't understand the need for early detection. Our own experience of the past 15 years is also a strength in embarking on the second stage of this project, which, as I've shown here, the primary prevention will be undertaken by the Ministry of Health through the HPV vaccination. In fact, it's incorporated into the National Immunization Program. As it is at the moment, the coverage is around 80%, which is quite commendable. And Rotary would come in on this for the secondary prevention, which would be really threefold. This would be the installation of an advanced technology HPV DNA testing machine for screening of cervical cancer, where actually the machine is capable of detecting the the two main virus types, the 16 and 18 genotype, which is prevalent in about 80% of cervical cancer cases. This would also be supported by the provision of
just one more minute to wind up. Sorry.
Yeah, this is my last
Okay,
slide. Mobile screening buses. It will be located in an area where we could reach out to where there is high incidence and low coverage, and accompanied by that, two key areas would be the capacity building, training of midwives, and the training of the trainers, where we would have our US partner, the Rotary Club of Birmingham, coming in for that, and a very structured public awareness campaign. So with this threefold approach, together with the ministry's vaccination program, we hope that we will be able to work towards the elimination of cervical cancer by 2030. And I want to end with this slide where we have shown our solidarity with the recent WHO launch of the strategy for elimination of cervical cancer by lighting our public monuments in teal to show that we very well welcome the strategy launch, and we look forward to working with the WHO to achieving our goal. Thank you.
Thank you so much, Nirmali. That was wonderful. And colleagues, I think that if anyone would like to have a copy of that presentation, and I'm sure that that's going to be the case, we will make sure that it is made available to you after the session with the recording of the event. Thank you so much, Nirmali. Now I'm going to jump straight in to our session 6, which is looking at the role of the life sciences and the pharmaceutical sector in cancer prevention, with, of course, a specific focus on cervical cancer elimination. And we know that for cervical cancer in particular, this link is especially critical and especially strong. And I'm very happy to be able to introduce Greg Perry, who's the Director General of the International Federation of Pharmaceutical Manufacturers and Associations. So we have exactly the right person to speak about this. Greg brings to that role over 2 decades of leadership and advocacy experience in public health care. And I think that his work on patents and generic medicines, we're probably not going to have time to go down that path, but your work on that has been really especially important to our topic, Greg. And I should mention as well that we also have in the wings Anuj Walia, who's really another great asset in this too short but very important session. Anuj is the Global Director of Medical Affairs for Merck and Co., which is, of course, one of the pharmaceutical organizations really at the forefront of this. So hopefully we'll be able to bring Anuj in, particularly if there are any technical aspects that we need to explore in detail. But at the moment, over to you, Greg. Thank you so much.
Okay, Dr. Gallagher, you do hear me? Yes, good. Okay. Look, I have to say I'm very honored to have followed all the previous speakers and all the amazing work that they've done, and especially listening to the personal stories of our cancer survivors. And I just have 2 sort of observations before I start. The first is the Commonwealth really is an amazing platform here. I mean, when I listen to what's being discussed today and looking at the broad group of people here, this really is an organization, you know, united in its diversity, but with unity in a language and I think a common cause. And for yourself, Dr. Gallagher and Baroness Scotland, I think you have an amazing opportunity and a mission in this public health area for the Commonwealth to really provide significant change which is required. And I think the COVID pandemic has shown in many respects, but also the need for serious government investment and in public health. And I think the Commonwealth will be an amazing engine to achieve that. it's not small, it's actually very big, but at the moment I think its impact is too small. Its potential is fantastic. That was my first comment. The second thing is more personal. I think, you know, it covered a lot of areas in my job, but when it comes to cancer, it's one, and everybody will feel this who is participating. We're all impact in personal, family, close friends, colleagues, everyone is affected, and that's why I think anybody that's involved in this, and now talking from the life science sector, we're all part of that journey, both professionally and I think individually as people. Now, our own association, very quickly, we have 30 innovative companies and 50 national associations involved in the R&D of vaccines and treatments in many areas, but very concentrated in cancer as well. And just to say, we have 11 national associations from Commonwealth countries, and we have started to develop engagement with the Commonwealth, with the Commonwealth Initiative on Digital Health, and with the Commonwealth Pharmacists Association. Now, from a life science point of view, and particularly the industry of biopharmaceuticals, you know, we're very proud to be part of significant and unprecedented developments in treatments. When we look at the 83% life gain since 1980 for cancer patients, 83% of that is based on treatments, and we're seeing, you know, a large surge of innovation over the last decade, and that will continue, whether that's personalized medicines or looking for the cancer cure. But clearly, we need to address access, and everybody who is involved in the life science sectors, whether that's the biopharmaceutical companies, whether it's diagnostics, whether it's medical devices, we're dedicated to trying to provide access, but we need to work with everybody in the sector to be able to achieve that. And when we look at prevention, it's clearly that we need to invest as communities, as governments, you know, further upstream, whether it's in prevention, whether it's in diagnosis, whether it's in primary care. And that, of course, relates to what many speakers have talked about, is universal health coverage. And it's absolutely fundamental that we're able to close an access gap, which is a result of lack of universal health coverage in so many countries, including in the Commonwealth. Now, you know, as a sector, I want to make, you know, this statement here that we're dedicated to working with all parts of those involved in the cancer and oncology community. We are part of that journey. We know that we need a holistic approach. We know the importance of prevention. Prevention is important for families and as a person. It's far better to look at prevention than going further along the line. But also, we've got to get it across to the ministers of health, not just the ministers of, the ministers of finance, not just the ministers of health, the fundamental importance of investing in health infrastructure and health investment in general. It is the best cost-effective way of dealing with health and prevention, and investing in health is an economic plus. It's an investment, it's not a cost. And that's one of the things that I think we can work within the Commonwealth to try and get across to our ministers of health. I think in the coming years, we're going to see a lot of technological advances in the areas of prevention, you know, whether it'll be in the areas of digital health, or looking at various technologies which will help us to map the person in itself, to be able to work out what is specifically needed and differences between people that will be faced with cancer. And we will all need to work together as a private sector to achieve that. Now, let me come more directly to the issue of cervical cancer. And I want to make the statement here that our industry fully supports the WHO global strategy to accelerate cervical cancer elimination by 230. And it's a very ambitious program. for everybody. But as someone has said before, it may be ambitious, but it is achievable if we all work to that aim. Now, there will be different approaches for different countries. There will be different speeds that are going to happen. We need to have very strong, comprehensive, country-tailored approaches. We need to work together in prevention and screening and diagnosis, a collective effort again, but we need sustained political will from our political leaders, and we need, as I mentioned before, sustained investment in our healthcare structures to build the road that enables us to go through that journey. The industry itself and the vaccine manufacturers have already, I think, begun in that journey for the vaccination. There's been unprecedented scale up of vaccine supply. We've doubled that, I believe, over the last few years. But there will take time. It will take time to build up the next phase of supply that will be required. And what is also important as we're building that supply capacity up, that there is a proper planning, proper engagement with the governments, with the communities in making sure that we can have a sustainable and effective vaccine program. The industry itself has committed in the 2020 Gavi replenishment to provide Gavi with the supply of the HPV vaccine that is required to meet their target of 84 million girls to receive the vaccine during that period of 2021 to 2030. One of the leading companies in this area, MSD, which my colleague is from, has also joined in a partnership with the International Federation of Pharmaceutical Wholesalers to invest and help in the structures required to ensure that we can get the supply there to the communities and to the young women that need it. Finally, because I know I'm winding up here, I have to, is to do with the need to deal with vaccine hesitancy. It was mentioned, I believe, by the Minister of Ghana before, and it's one of the things that the Commonwealth could really work together to deal with, is to address this issue. It's not just a minority of anti-vaccination activists. I think it runs a little bit more deeper than that, and we really need to work together, I think, to deal with that challenge as well. I'm very happy to address other things later in a discussion, but I think I'll leave it there for the moment. And thank you very much again for the opportunity to speak.
Thank you so much, Greg. I think that where do we start? I already have 10 questions there. So I'm just now very much wishing that we had at least another hour for this session, because there's a build-up of questions, both from participants and from myself, from our previous two panels as well. But can I just quickly check if Anuj Walia, who's the Global Director of the Medical Affairs at Merck. Anuj, would you like to just come in with a very quick observation, perhaps on winding up what Greg has been saying? Your perspective would be really interesting to us, please.
Thank you. Can you hear me well?
Very well, thank you.
All right, thank you. So firstly, I want to start by thanking you for giving me the opportunity to come here and express my views. I've spent close to 14 years in this fight against cancer, and I think the biggest concern that we have right now is the lack of awareness on the fact that these cancers can now be prevented. Back in medical school, as a pediatrician, we learned that prevention is better than cure. We've heard some of these brave stories of ladies who've gone through cancers. And today we have a unique situation where, we've got means and methods in which we can actually prevent cancers. I work with a vaccine, and I've been working with this vaccine for over a decade, and I've been to several countries. I've traveled to more than 30 countries across the world. to help introduce these vaccines. And it's such an amazing feeling that you can go and talk to people and you can tell them that today you have an opportunity, that if you're young enough and if you can take this vaccine today, you can prevent yourself in the future against not just cervical cancer, but vaccines can now prevent you against vulvar cancer, vaginal cancer, anal cancers. We are beginning to explore other kinds of cancers and diseases, including genital warts as well. I have great memories of traveling to Bhutan in 2010 when this vaccine was launched, and you see where Bhutan has reached today with the implementation of this vaccine program. They recently published a paper to show that there is an 88% decline in HPV infections in Bhutan. I have lovely memories from Sri Lanka, and I visited Sri Lanka in the year 2015 in October, and I was invited by the Pediatric Society to make a presentation on HPV vaccines. And about a year after that, in 2017, they started a vaccination program. And it's so great to see the progress that they're making, and the fact that they have goals which are as ambitious as to achieve elimination of cervical cancer. So it's really a very, very encouraging time. And as Greg mentioned, that's the one point that I really want to highlight. My biggest learning in these 14 years as I've gone across the world trying to help launch this vaccine, create awareness about prevention, is that we really need to strengthen ourselves, strengthen our systems to combat vaccines confidence. Because it's not about whether this is going to happen, it's about when this is going to happen. And we live in a world which is surrounded by social media, and people want to post something on social media and Twitter and Facebook, and these things circulate from one country to the other. And when they circulate, they can create ripples that continue to be in that country for several years. So if all of us can work together and try and combat this, I think there are great strides that we can make in trying to conquer and overcome this burden of cancer that surrounds us. Thank you.
Anne, you're self-muted, Anne. You need to unmute your microphone.
Sorry about that. I was just thanking Dr. Anuj very much for that, and for bringing through a thread from this morning's discussion, which is around reluctance around vaccination, and how for a cancer such as cervical cancer, that can have such a terrible, devastating effect on something that we can actually prevent in a way that so many other cancers can't be prevented. So thank you for that great reminder, a really good and timely intervention, much appreciated. Now, we are coming to the end of our session, and it's an awful responsibility of the moderator then to not keep giving the floor to those that we so much want to hear from. But I'm going to jump to Dr. Julie Tarode, who's a leading cancer researcher and prevention advocate. She's speaking here about global advocacy and using her platform or speaking from her role as Deputy CEO and Director of Special Projects and Advocacy at the Union for International Cancer Control. Julie, thank you so much. Looking forward to your brief presentation.
Thanks very much, Anne. I must say I've really enjoyed the session and the rich contributions from all of our panelists up to now. They're making my job a little bit easier to summarise and close the session. So, ladies and gentlemen.
Julie, sorry to disturb you. Could I ask you to share your webcam? You're not on screen at the moment. There you are.
Oh,
perfect.
okay.
Thank you.
And is my presentation visible?
It is now, yes, thank you.
Excellent. Okay, thanks for that guidance. So, ladies and gentlemen, friends, fellow cancer survivors, it is a pleasure for me to join this session and renew our focus on cervical cancer elimination and highlight opportunities to drive the broader cancer prevention and early detection message. As we heard from Monica, taking action on risk factors is important for many cancers, but it's also common across other non-communicable diseases like diabetes and heart and lung disease.
we talk about reducing modifiable risk factors, but these are simply the things that we as individuals can do something about. The common ones are tobacco, alcohol, physical inactivity, poor nutrition, and overweight and obesity. And these numbers are just some inserts from myself from a recent survey that UICC conducted earlier this year. We're in 20 countries with over 15,000 participants. And when we asked them to name a risk factor for cancer, it was surprising to see 68% actually recognizing tobacco as a risk factor for cancer. And as it is such a dominant cause of cancer, influencing over 10 types of cancer, including cervical cancer, it's an important one that we need to build this number up on. And I include those numbers to show that the knowledge around these other risk factors, there's a real gap here. Only 35% of respondents knew that alcohol was a risk, and for the others, 28%. So we have a knowledge gap we need to fill. And we also need to get the message to those most vulnerable, those with lower education, those that are less digitally connected, and the poor and rural communities, which we heard from Maud that she's working so well in. But I think we need to challenge ourselves. Knowing about risk factors is not always understanding, and we need to have the ability to act on that information. So we must get the message out there. And we need a really strong policy environment to support individual action. Just looking at this basketball field here, if it's not well maintained and unsafe to play in, then it's not very helpful. Or what if it's in an unsafe environment where children can't play? So policies are so important. It's great to hear that cancer advocates and cancer patients are getting out there to share the cancer story. What we're aiming for is to improve cancer health literacy across the life course. Going back to that survey, only 28% of respondents knew that a virus could cause cancer. And in fact, we have 2 vaccines to prevent cancer. The hepatitis B vaccine, which is given to newborns, can prevent liver cancer, and the human papillomavirus vaccine, which can prevent cervical cancer, where we vaccinate young girls. But one of the risk factors for cancer, which was not recognised by respondents to the survey, was age. Of course, we're all aging and we can't stop that. But we can be informed about the right ages to start being concerned about common cancers and when we can attend screening. This is particularly important for very common cancers like breast cancer, bowel cancer, cervical cancer, and oral cancers, which Monica mentioned in India particularly. So this is critical information for the public. Also, we do not hear enough about signs and symptoms of cancer. After a diagnosis, it's just too late. So for example, how many parents of children with cancer have said, I knew the tiredness and fatigue was not normal. Why was it so hard to see a specialist? Again, signs and symptoms, critical information for individuals to be able to act. This is especially the case with cervical cancer in Nigeria, for example. 7 out of 10 women are diagnosed with stage 3 or 4 cancer. This is an advanced cancer, beyond which time there is any cure. These bring severe symptoms, acute pain, and severe suffering, robbing women of much of their dignity. This leads to more stigma and shame. And this is compounded by lack of access to palliative care in many settings. These women's stories are tragic, and we should not shy away from the shock of this story. It's unacceptable, and we must do more. So this is why it was an exciting moment this week to see the globe adopt a new commitment to eliminate cervical cancer, and all our governments signed up to that. It's a global promise to resign a cancer to the history books for the first time. So let's take a closer look at that strategy. Well, we do have a public-friendly vision, a world free of cervical cancer, and I think we can all understand that. But we're working towards a threshold of 4 per 100,000 women diagnosed each year. That's a little bit more confusing to understand. So to put that into context, what we're saying is we're trying to push the rates of cervical cancer down below that of a definition of a rare cancer. As we've just heard, we do have a vaccine for HPV. We've heard so much about COVID-19, infection and disease, but we have a vaccine for HPV, the human papillomavirus. We have a test for HPV. And once we have a positive test, we know how to look for precancers, which we can treat, and that stops progression to cervical cancer. And we also know how to treat and cure early cervical cancer. So many opportunities to act, and this is shaping the 10-year horizon of the strategy. What we want to see is 90% vaccination of girls by age 15. What we want to see is 70% coverage of screening of women by age 35 and a second screen by age 45. And what we want to see is at least 90% of all positive cases and all cancers being followed up. Tragically, so many women are being lost in the health system. So it's a big, big challenge for us, but something that we have to do. And as Alan mentioned earlier on, linking that to universal health coverage and making sure we leave no one behind, because it's the access to those prevention services that are so key, and financial protection, particularly for women with cancer, to make sure that families stay intact. So does that sound easy? Well, it can be, but I think our challenge really is to focus efforts where the burden is highest. The dark purple countries here have high burdens in cervical cancer, particularly in sub-Saharan Africa. We're talking about 70 to 80 per 100,000 compared to that goal of 4 per 100,000 that we need to get to. It's the poorest countries in sub-Saharan Africa, Latin America and Southeast Asia that have the highest diagnoses. And it's them that we need to give more investment to build their health systems and create that response. I was glad to hear about the engagement of the HIV community, and this is so critical. We know that women living with HIV are more likely to contract HPV and more likely to get cervical cancer, 6 times more likely than someone without HIV. This is, again, critical information for individuals to be able to act. So what can we do to accelerate action? Well, we can join forces, and I think we can start today with the cancer community. There are 43.8 million people living in the world with a diagnosis of cancer within the last 5 years. And there's a lot of people to start this movement. We can add long-term survivors like myself who 10, 15, 20 years are after a diagnosis. We can add women who have access screening and got the good news that they don't have HPV, that they haven't got a pre-cancer. That sense of well-being, can we engage these women to share that in their communities? Can we bring in the HIV community? Can we bring in women's rights and empowerment groups, community leaders and youth voices? Sorry, Anne, I saw you waving at me, but I can't hear you. I do only have, I could go to my last slide if you're tight for time.
Sorry. And you're
okay,
muted.
thank you very much. I was having problems with my microphone, which has just been fixed. You will have to go to your last slide. Sorry, Julie, we've already
no problem. I think we covered a lot of the points in this slide, so I'm happy to skip that one. And to really go to the last slide, which is the clock to 2030 is ticking. So our immediate focus is translating global commitments into national action. So I'm really recommending 3 early steps that we can take with the Commonwealth community. So can we urge Commonwealth governments to make public commitments to elimination. This is so important to empowering girls and women to take part in prevention services. Can we press governments to work with World Health Organization to model when elimination is feasible in their countries? This will be a galvanizing timeline for national action. And can we encourage early update of cancer plans, creating new cervical cancer elimination strategies with taking the 2030 targets in mind? And then a last plea to you, our audience. I think you've learned today that your voice is just as important as everyone else's. So can you add your voice and join UICC in signing up to the Commonwealth Can Stop Cervical Cancer Pledge? So I thank you for your attention, and back to you, Anne.
Thank you very much, Julie. That was really, I think it was a wonderful way to wind up our session, to take a look at the bigger picture and to understand how the global momentum, especially around cervical cancer in particular, needs to be constantly energized, and we all need to be on board with that. Thank you so much. Now I'm going to ask our beloved Secretary General, who's been with us through this whole session, to share some closing remarks with you, and then I'll come back to just say some final things before we finish. Dear Secretary General, you have the floor.
Thank you, Anne. I hope that you can all see me. I think this has been the most extraordinary session, not least because we started with the correct focus. We know that this isn't just an esoteric exercise limited to what we need to do medically and intellectually. This is about real women's lives which are ripped asunder by a disease which is utterly preventable. It is about the unfairness of knowing that the geographical location and the economic position that women may find themselves born into may be the final determinant as to whether they survive, whether their children have the opportunity to be nurtured and supported by them. It was also a breathtaking demonstration of the resilience of women, the determination of women, and the opportunity to allow us the privilege of really understanding the pain that comes from cancer, not just the cancer itself, but the aftermath, the depression, the challenge, the illnesses, the disabilities that can flow from the side effects of the cancer. But today has been a remarkable day because we have also seen the extraordinary power of our Commonwealth. The fact that we have 2.5 billion people, 60% of whom are all under the age of 30, willing to join together with one voice to say, this will not continue and not in our name. It's true that none of us are able to do this on our own. We need our government's determination and political will. We need our local authorities to understand how they too can make a contribution. We need the power of our scientists and our academics and those who have spent their whole lives investing in the knowledge and the understanding of what works and what doesn't work. We need the private sector to meld their understanding and join with us. We need our contribution from civil society. All of this is part of our future. And it has been a true privilege to listen to every single contribution that has been made, every speaker. And I know that some of the words that we've heard today will haunt us as much as they will inspire us. Because listening and learning from all of our guests today, I think has been absolutely extraordinary. And I must especially commend the courage of our wonderful survivors who have boldly today told us their stories. And we felt their pain, we heard the pain in their voices as they retailed to us the nature of their journey. And we believe in their resilience and we stand with them. But I want to take a moment just to think of all of those who will have been listening to that journey and will know that their reality was reflecting the experience of those who have suffered with them. And for those of us who have had people in our lives, our family members, our friends who we've loved, some of whom we've lost, I think it welds us more firmly to the conviction and the determination that we will bring an end to this scourge. And we recognize the urgency of the situation and the need to take action. And the Commonwealth will facilitate the necessary connections needed to make an impact at the scale with the Commonwealth Foundation, the Union of International Cancer Control, the private sector, and academia. We also know that we can do more. And indeed, we are making strides towards delivering on more. And the Commonwealth will be launching a movement. And we're going to call this movement for the women in our lives across all 54 states, in a bold step towards changing the narrative on cervical and indeed all cancers. We want to change the narrative and address the misinformation that so often serves as a huge barrier to utilizing the tools we have at our disposal that can significantly impact on cervical cancer. We hope to bring messages of hope, care, and support to enable women and everyone in general to take the necessary steps towards taking action on cervical cancer. And I can't tell you how proud I have been today of our Commonwealth, proud of the commitment, proud of the determination, proud actually of the love that has been expressed, because we know we cannot do this alone. For what we do know is together we are invincible. And so I want to thank each and every one of you who've listened, who've participated, who've spoken, or I know from looking at the chat, who've maybe cried as a result of what they have listened to, because none of the work we have done will be in vain. And together, we are going to take really bold actions that will be the difference, and we will make the difference at scale. So can I say from the bottom of my heart, God bless you, thank you, and we will, with your help, succeed. And thank you, Anne, for being with us all the way through. I think our partnership with the partnership of all the other Commonwealth organizations is what we makes the Commonwealth special. So to everyone, thank you, thank you, thank you. And I'm doing that on behalf of 2.5 billion people.
Thank you very much to our Secretary General, who provides such inspirational leader to all parts of the Commonwealth, including the foundation. So colleagues, my job is to very, very quickly follow up with just a couple of closing remarks where it's the impossible task that I have of trying to draw out the golden threads of this 2 hours and 20 minutes that we've just spent together. So I'm going to do it very briefly. It's inevitable that it's going to be inadequate, but hopefully it will reinforce some of the Secretary General's conclusions and the spirit and the soul, as well as the substance of what you took from today's session. So I think the first thing to talk about is what we got from the first session, the reminder of the importance to address stigma, to tackle the language that we use around cancer, to ensure, and this spilled over to the second session, to ensure that we do everything around getting people access to information for everyone, making sure especially that we focus on those who risk being left behind, young women, rural women and girls, those living with HIV. The second message that came through loud and clear across multiple panels was the need for a genuinely interdisciplinary and holistic approach. We have to work together. So that means, as the Secretary General and others said, civil society and the private sector, international advocates working with those who are operating at the grassroots. And it's also about this idea of holistic response to cervical and other cancers. We need to work across all fronts and in relation to all cancers. Another theme that came through strongly and clearly was, I think, around public health and investment in public health. The pandemic that we're still experiencing in such a raw and immediate way has really changed the conversation around investment in public health. From COVID to cancer, we need to reimagine what public health could be, what it should be into the future. And I think another message amongst many, but perhaps an especially important one, was the
And there you are.
No, I was not self-muted. I was otherwise muted. So we need to bring people into every aspect of cancer awareness, prevention and treatment. We must put people at the centre. And whether it was our representatives of the private sector, whether it was those working in rural communities, whether it was the survivors, whether it was the top oncology researchers, everyone said the same thing. The people need to be at the centre of our response at every level. So I'm left with 4 words that I scribbled down at various points during this session, and perhaps that's the best way to finish. The words were love and hope, compassion and gratitude. And if we can bring the spirit of what's behind these 4 powerful words, as well as all of these wonderful speakers that we had today if we're able to move ahead in this difficult road with love and hope, compassion and gratitude, then I think we're doing very, very well. Thank you to everyone. I feel the same as the Secretary General. This has not been the kind of international policy discussion that I'm used to. It's been so powerful and so thoughtful and so caring. So thank you to everyone who's been involved in delivering it, not least our wonderful speakers. Thank you and good day, good evening, good night.
In 2018, it was reported that the Commonwealth had 425,000 women with cervical cancer and 13 women dying every hour from this disease. These deaths are largely preventable.
Due to poor access of HPV vaccination, HPV screening, treatment, and palliative care.
Despite global efforts at combating the scourge of cervical cancer, the incidence is still rising in the Commonwealth, with huge social, economic, and health implications.
There are several key actions that the Commonwealth member states can take.
With measures as simple as screening and vaccinations, over 5 million women's lives can be saved by the year 2050.
We have a long-standing cervical screening program in New Zealand which has reduced mortality from cervical cancer by 60%. For our neighbours in the Pacific, cervical cancer remains the second or third leading cause of cancer death for women. They need support and resource to help deliver effective HPV immunisation and cervical screening programs.
I'm Callie Palmer, National Cancer Director for NHS England and Improvement.
This is Joya Alsan, an actor joining the Commonwealth from Bangladesh.
My name is Maud Mwakasungwa. I'm a health advocate from Malawi.
Dr. Sahon Enabulele, President of the Commonwealth Medical Association.
I am Professor Isaac Adewale from Nigeria.
My name is Diana Safati. I'm the National Director of Cancer Control here in Aotearoa, New Zealand.
My name is Nadia Jamil. I'm an actor, a teacher, child protection activist, and a cancer survivor from Pakistan.
The time to act more decisively to flatten the cervical cancer curve is now.
It is important that our leaders focus on making screening for cervical cancer available nationally, while young girls aged 9 to 14 years are offered HPV vaccines free of charge.
To put more resources into the cervical cancer program so that we have mobile clinics which can reach areas where there are no services at all.
I urge women to make use of those vaccinations and those screening facilities.
I feel extremely proud to take the Commonwealth Can Stop the Cervical Cancer Pledge.
Sign up to the Commonwealth Can Stop Cervical Cancer Pledge.
Together we can eliminate cervical cancer.
We can make a difference to people experiencing cancer and the effects of cancer around the world.
Thank you very much for your participation across both events today. Without your participation, this would not have been a successful event. Thank you very much to all of our panelists and attendees, and goodbye for now.